I'm done.
Okay. So let's get Mayor Hoffman. He's been advocating for transparency. Mayor, were you satisfied when they released more information about the COVID positive patients yesterday?
For me personally, because I know some of the people that actually do have it. That I was aware of it there, but I'm hoping at least they started to give some of the information. I know they're still doing backtracking, but just in our little discussion with the mayors, at least we kind of have an overview of where it might be and stuff like that in that sense. So it was between that and then finding, again with the home isolations, we posed the question again, and they said that they were moving them, or they're moving some of them in a specific area, and there was, I guess, they needed a larger area. Now that the numbers jumped on Sunday, that they ended up having to get another specific area. So now they were doing all these transports and kind of shifting these people around. So I think that's what they've been doing yesterday.
So you did have a conversation. The mayors had a conversation with the government.
Yes.
So
about that specifically, because after you raised that question with me, Sabrina, I said, by the way, did I just hear that correct? That they're still at home isolation? I thought they were being moved, and they said, well, they said they needed a facility, and it's harder to spread people around in, I guess, the 3 sites that they had between the airport quarantine folks. So they kind of, make their resources all into one, so it's easier to guard and protect and sanitize. So it took a while for them to prepare. Actually, a facility, they have to go in there, clean it, sanitize it, move everything, stock it with everything it needs, and then from there, doing the transport and doing the logistics for it.
So, what did they tell you? The SNU facility was there? What's the capacity there? 40?
I think it's a 60 bed.
60 bed facility, and only when we last spoke with them, it was only 2 wards were ready out of the.
I think 1 ward was ready, and they had moved 2 patients, maybe.
Mm-hmm.
I think those are for the ones that I guess are in that critical or the fair part, but the ones that are asymptomatic, they're at a separate location.
Right. Do you know that location, Mayor?
Mm-hmm.
I believe. If I'm not mistaken, I believe it's the Pacific Star.
Right. Yeah, that's what.
Wait, that's Pacific Stars for who?
The Pacific Star, the asymptomatic.
For asymptomatic.
Yeah.
Okay.
Okay, because I had actually messaged Crystal yesterday about situations with the people who are in quarantine at the approved quarantine facilities, and she had mentioned that there were. Let me just pull it up because.
Yeah, it's hard. It's constantly changing.
Yes,
it's a rapidly evolving, Mayor. That's what we're saying.
Some of the people that are in quarantine are being transferred, and I think there's a difference between whether you're on quarantine and you're on home isolation. This specifically
home isolation means you got it. I mean, you're
right,
positive.
and quarantine is you need to stay away from the public for the 14 days. But
right.
Yeah,
she can't.
Those are the home isolation. I think the governor said yesterday if they don't have a separate bathroom, they have problems trying to home isolate because either the number of people in the house, or they also don't have a separate bathroom, separate bedroom that's required. If they don't have that, then that's where the government kind of steps in to kind of put them into an accommodation. So
right.
I believe that's what's going on right now.
So the SNU, are we saying that it might not have separate bathrooms in each?
But I think it's because it's a medical facility. Those that without symptoms, that is not needing any kind of respirator and all the other stuff. I think they're moving into just a specific area where they can just write it out.
But you're hearing that the possibilities that they're going to move the home isolation patients to the Pacific Star, not the quarantine passengers?
The ones that are home isolation that can't meet the requirement, from what our discussion, I think we took away from it, our takeaway was that they're being moved to a specific facility that's easier to I guess no community exposure.
Mm-hmm.
Right.
So I think they're trying to convince everybody to kind of go ahead and go to report or get picked up and go there. But I know that public health's been calling those that are home isolation twice a day. They are checking up on them. The surveillance teams are out there. I know because people, like I said, the people that I know are being called. They're like, wow, they're
like house arrest.
Being called, yeah, they're being called. They're being visited. So I was like, okay, this is, they're kind of getting into the flow of this, and they're kind of seeing the way of it. And so even with some of our Manumco here, even though they're not positive whatsoever, because they were on that list, they were being called twice a day. Also, just double checking on them. I believe Friday is kind of their clear day. If they no symptoms by the time Friday, that means they weren't exposed to any kind of the virus. So we're all just waiting for Friday on our end to see, and then that at least our 70 Manumco within that facility would be at least breathe that sigh of relief.
Yeah, but then they would still just stay indoors and
they would still stay indoors. They are bored every time I talk to them. So today's going to be the first time none of them can, because some of them want to come by and pick up their meals. So all of them were being told by public health yesterday in their call saying, "Do not go anywhere. We're almost out of that gate there, so do not go anywhere. We'll bring the food to you." So we're just coordinating that with all our various mayors.
So, Mayor, it kind of sounds like they did things and you changed your tune, so you're now satisfied with...
We're still asking the village specifics. That's something we're still pressing for on that end, and we still want at least the information that the doctors are asking for, the clinics, places they've been to. We're still asking for that. So we're just, we're trying to flatten that curve, and we said, help us help you. That's basically been our mantra to them, saying help, and hoping that's kind of falling on the ears that need to happen. And what concerned us when they released the statistics, there were 6 villages that were unknown, or 6 cases that are unknown. I was like, how do you have unknown
residents? Yeah,
these people can talk. So it's not like they don't have, or they have family members there, and
right,
they would have brought them to sign them in. So we're pressing for that information.
And what's the response been like, Mayor? Do you think that this is going to be something that you guys are going to get, or are they just not budging on it?
I believe they're going to get it. I think it has to go through like 3 or 4 different channels. So wherever they were tested, then it's whoever I took was the receiving report. Because there's no one place I think they go. Like, I think the people who have the results in the lab have to match it up to, I guess they don't put a name, they put a unique coded number or whatever else like that, and all these. So it goes to like 3 or 4 different people. So we're just trying to figure out, are we asking the right people? And we're asking Homeland, who we're told to deal with, but I think Homeland asks Public Health, and Public Health asks GMH, and GMH. So I think it goes some channel.
Was this a Zoom a Zoom conference, or how did you guys meet? Was it all the mayors, or?
We were invited to participate, and we just rather watch it. So I watched it from your website instead of dialing in, because I saw what happened with some of those other reporters there. Was
right.
Kind of interesting.
So putting it mildly. Hey, how about that Zoom app? You ever download that Zoom app? That's pretty cool, right? Yeah, I'm on it right now.
I just dial the phone number and then put in that code.
No, but did the mayors have a conference with the governor or the Homeland people? Was this a meeting that you guys usually have on Mondays?
No, we've been communicating just when we have a specific WhatsApp chat for it.
Okay.
And then that's basically we're just dealing on that is representative from the governor's office, somebody from Homeland, and I think that's it, the 2 that we're dealing with on this specific for that.
Mayor, we had a comment here from Alicia. I think it's crazy how residents that tested positive are being sent home to do home quarantine, which is risking the other residents in their household possibly becoming positive.
There's a difference, home quarantine and home isolation.
Right,
so
yeah. Well, I think she means home isolation.
Okay.
Right.
Yeah, home isolation. Yeah, they signed these papers that are saying that, it's like, I promise not to go out, and I got to do this and do that, and I will meet the requirements. So at least I believe now that they do that, and with these inspections, stuff like that, it kind of does offer some layer of, okay, you are meeting the requirement and you are staying home, because I think they know that they're infectious in a way, and I'm just hoping they're family members. But I agree with Alicia on that, and I would feel more comfortable knowing they're somewhere specific and isolated, at least write it out for the next 14 days. I mean, the more that people don't stay home and the more that people go out and more they become potentially hazardous, we're going to keep kicking the can down the road and extending this closure of the government till beyond April.
Just for clarification, your understanding based on your communications via WhatsApp is that these home isolation positive confirmed patients, the plan is to move them to the Pacific Star? If their homes don't meet certain guidelines?
Yes.
Okay, because I was under the understanding that it was the quarantine passengers.
Yeah, they're using 3 facility or 3 hotels or something like that. Wyndham, Days Inn, and Pacific Star, or something like that, I believe. Right.
No. Okay, wait.
Yeah. For quarantine passengers, so the government's using 3 facilities. Where they're placing them, it's kind of like I guess they're moving them around depending on what resources they need to, do that. So I think they're trying to clear out one area to prepare it for another area, for another arrival of another group, or some sort of that way. Mm-hmm. So I know, and I know they're actively testing, because several of the people that arrived were also tested.
Right. Yeah. But one of the quarantine passengers that communicates with us, he gets tested. He was getting tested twice daily, and I think it's down to one. That's Dave Sablon. We're going to have him on later. Mm-hmm. But I just want to make sure we're clear. You're saying the home isolation positive patients are going to PacStar.
Only if their house doesn't have what they need to, to do home isolation in a manner the public health approves.
And I believe they're given the option to do all those things. And I'm not sure if they're being ordered to move over yet. We're going to be asking that question today, of how many were transported and how many were able to avail themselves of that opportunity to home isolate in a specific place. And I think for some of them who are positive, who are in home isolation, they might require care, because some of them are elderly. Mm-hmm. They might require some kind of care, and I think so. That's probably the better option for them, is to be at a home isolation for that. So that's something that we talked about. Some of them require, some of them are elderly that require some assistance, but now it's making sure that family member does all the proper sanitation.
Right. I feel like it's putting a lot of pressure on the family members. And
it is. It's
Mayor,
hard to do so.
In a perfect world, though, if you had your way, Robert Hoffman's calling the shots. Oh Lordy, would you want all COVID-19 positive patients to be housed in some type of quasi-government isolation facility, as opposed to them just being at home?
Yes. It would give everybody else a sigh of relief on that end, and then it could make everybody focus just on the testing and sanitation of the community and everything else that we can do, because we're asking, is any of these positive cases related to each other where they would have been exposed, and we're still waiting for the answers on that, because that the number that's climbed was we're trying to figure out, was that jump because those people in home isolation or around that were exposed to people who were positive, and we didn't get an answer on that.
Yeah, and I think that's the problem, is we're doing a lot of guesswork over here.
Mm-hmm.
Yes,
trying to fill in the gaps.
The mayor, I feel bad for my colleague, Mayor Mauricio. He's still trying to figure out, because that bingo thing hasn't really concerned, especially when now that the numbers came out kind of saying they're from the south. He's trying to put two and two together on that end. But, he's had, I think 2 times they had bingo fundraisers or something around that, of that manner. And so he's kind of, he's been asking for answers of where specifically and what dates, and he's trying to get a hold of residents. So, if they can release at least, some facilities, some activity that happened, what about the rest of those other cases? Where did they work? What did they do? Why is it taking this long?
I wanted to wanted to follow up again on that home isolation, but this one about so home isolation, from what you understand, if they don't meet guidelines, they'll be moved to Pacific Star. But for quarantine passengers, what are you hearing? Are you hearing that they're going to be moved as well, or staying put?
No, not that I know of. I know that I think from what we gather from it is that they're just trying to consolidate, so they're not stretching out the resources. I think if anyone's gone up to SNU, it's almost like entering a military base. You pass two sentries, and then you have all these other things. It's a really guarded area, and that we're actually, the mayor of Barragata is having a problem, because there's residents who live behind the area. So she's actually had to make a car pass for her residents who live there, so they don't constantly get stopped and get given the whole rundown of what are you doing here, why are you here?
Right.
Like, we live further down, how many times and the guard constantly changes, and the several guards change. So
right.
She asked us yesterday, is it okay if I make your own pass? And I said, make your own pass and just tell them I am a resident of this street. But so I think it's just a matter of them consolidating resources, putting where it needs to be. So the passengers who are showing no symptoms, who are under that quarantine rule, don't have as much, they're still guarded, but I guess not as protected as people who are under that home isolation or the isolation order and being moved to a specific area where they can actually have more people, either in the hallways, on the road, and the entrance of the lobby, and all the other places, those hotels. I mean, bless those hotels for stepping up. I mean, that's a hard thing to do.
Mm-hmm. Yeah, because from what I understand, there's 3 quarantine facilities: Wyndham Garden, Days Inn, and Santa Fe. And then, yesterday we got word that they were moving some of the quarantine passengers to PacStar. That's why I'm kind of confused about now. You're hearing that home isolation patients are moving to PacStar.
Well, maybe we'll get that info later.
Well,
today.
there's going to be a press conference at 1:00, and according to what Crystal mentioned yesterday in a chat that I had with her, is that there's supposed to be more information related to the movement of quarantine passengers to another facility.
We had another comment here from Pam. Why are we moving and mixing everyone around? Persons under investigation and confirmed cases are all moving around. Can we skip the home isolation? How come the confirmed cases get to choose and passengers from Manila are mandated to stay at the hotel? That is confusing.
It is, and I think that's we brought that up several times, and we're just trying to see. We understand it's for the health of everybody, and we're just trying to see. I think if there was more test kits, it would be easier to kind of not have to take those Manila passengers and put them in at these places. But it's the number of facilities that are available, and I think that's what the word we got was that they're just trying to work on preparing, and all the other things of these facilities. So, yeah, it is confusing, and that's something I will ask this morning.
Right. Well, there you go. Thank you, Mayor Hoffman. Anything? Did you watch the press conference? Did you have anything to add on maybe Dr. Cabrera's comments about the healthcare system reaching its breaking point?
It is. It's an eye opener for us. I mean, the 200% versus the 33%, which I prefer to see zero. I prefer it to be lower, and I think it's just people want the areas closed and Guam on lockdown, and it's just I'm surprised really that the military, the federal workers, and civilian federal workers are still not being told to stay home, and they're still going out and about, and their office spaces can range in terms of the number of people. So it doesn't help when not everybody's participating. I saw a post yesterday when a lot of other companies that weren't usually closing are finally closing or reducing hours, whichever else like that. But I think it's easier. They said it, and I read that if you just completely lock it down and just everything stops.
Right. Yeah, and it's interesting how they're holding up these other places as kind of an example, and then doing things that those other places aren't doing, like less stringent lockdowns or mandatory social isolation orders.
Yeah, it's hard, and I think it's I don't think no matter what Guam does, I think it's just going to be hard to do because the rest of the world still hasn't kicked it, and so we could be corona free for 3 or 4 days, show no testing, no spread. It just takes 1 or 2 passengers coming home from.
Right, and that's what we're seeing in Hong Kong. I was reading something about Hong Kong where they had managed to flatten the curve, and then with imported cases, they're almost right back where they started from.
Hong Kong and Taipei, Taiwan, that's happening right now, and
right.
I just read the reports that China is expecting the second wave of this coronavirus. So it's concerning.
But yeah, it is. I went down that rabbit hole too last night, Mayor. I clicked on one national story, after just reading about everything that's going on here. I was like, let me just click on this, an hour later, about 3 panic attacks after. I was like, let me just.
I agree. I was just like, man, world, get it together. Figure this out.
Because we're following your lead, right?
Yeah.
Okay.
Yeah, so it's hard to do. But yeah, we remain hopeful, and we continue to pray, and which that's the least we can do. But we're going to ask those questions, and if you have any questions, you let me know. You know to get a hold of me, and we'll pose it to the powers that be.
Okay, thank you, Mayor.
Thanks, Mayor.
All right, take care.
All right, there you go. You too. Wash your hands. Yep, good advice there, Mayor Robert Hoffman. I really want to, I think it's very courageous of the mayors to